Hello and welcome to our special call-in show on coronavirus. Here we answer all the questions, all the doubts, any confusion you may have regarding the disease, and we have doctors taking all those questions for you. We're joined by Dr. Upendra Kaul, Chairman, Batra Heart Center Cardiologist, Dr. Suranjit Chatterjee, Senior Consultant, Internal Medicine, Indraprastha Apollo Hospital, and Dr. Ravi Godse, MD, Attending Physician, Director of Discharge Planning, joining us from Pennsylvania, UPMC Shady Side. Thank you so much for joining us this morning. Well, up first, Dr. Chatterjee, I actually wanted to ask you about this, this much talked about plasma therapy that we're doing. We're testing it on patients here in Delhi. They've had some amount of success. If you could explain it to us, and why are we not seeing it being used more?
See, this virus was a novel virus. People really didn't know the therapies, how to go about it. But yes, then gradually the evidence from the previous viral illnesses told us that the plasma therapy could be useful. Obviously, it is the convalescent plasma therapy where antibodies from a person who has already had this disease, from there we take out the plasma and infuse it to patients who are really sick COVID-19 patients. Not in general patients who have a bit of a cough and fever or who require a bit of an oxygen, but patients who are on ventilators requiring high support, they are the candidates for plasma therapy. And what Delhi has shown is in the last couple of days, it has been used in a couple of patients, and it shows that they are actually coming out of the ventilator treatment, even they are almost on the verge of going home or coming out of the ICU. So that is really good news for us, at least for the moment. But time would tell us as to how things are going to behave in the next couple of days or weeks to come.
All right, Dr. Godse, is this something that you're seeing in the United States as well? Are you using plasma therapy? If you could, tell us about what sort of treatments are being tried there.
Yes, FDA has approved it. I can request it for any of my patients. And the trials have just started. But I wanted to make a very important point in the beginning. Say, we hope that the plasma therapy is going to be effective. But whether we know it's effective or not effective, the time to start collecting plasma is right now. Right. We are hoping that the peak doesn't come to India. But in case the peak comes to India, this is like we are in the first over of a one-day match. So we can't reach the 40th over and say, pehle marna chahiye tha. So we should start, right now we should start collecting the plasma and be ready. If plasma works, great. If it doesn't, anyways, But we are doing it in US.
All right, a very important point there, Dr. Godse, because yesterday we did have the Chief Minister of Delhi actually appealing to those patients who have recovered from coronavirus to please come forward and donate their blood, donate their plasma, saying that you can help save somebody's life.
But can I say something very different out of the box thinking? And that is, we keep talking about the patients who have recovered from coronavirus, okay? In Second World War, the planes used to come back with bullet holes in them. And the engineer was trying to reinforce by putting the metal plate without making the plane heavy. And they were trying to cover the bullet holes. And some genius said, let's not cover the bullet holes because those planes survived, they came back. Let's cover the areas that doesn't have the bullet holes. So I'm saying there could be about 15 to 20% patients who have had coronavirus, have antibodies, don't even know it, and they didn't even get sick. So they may have good antibodies. So let's task the masses that helps towards cutting down the lockdown, and then maybe get antibodies from even healthy patients. It doesn't have to be recovered patients,
All right, that's very interesting because Dr. Chatterjee, this is something we've seen in India, that 80% of the people are asymptomatic, which is also a worry when we talk about lifting the lockdown or easing anything, because a lot of people are walking around, they don't even know they may have coronavirus and may have even recovered from it.
True, absolutely. And as I said, if we can really collect the samples from people who have good antibody titers once they have recovered, or basically we'll only come to know of it once the testings really happen. The rapid testing, if they tell us that, okay, they have the IgG antibodies there in them, and we can really know that, okay, these people suffered from this illness without having manifestations, then we can get a lot of sample from them, and if really found to be useful, we can keep it at the store right now and use it as and when required.
All right, we have our first caller, Piali, calling in from Mumbai. Go ahead with your question, Piali.
Yeah, good morning, Gargi, and good morning, doctor. My question would be for Dr. Chatterjee. I'm from Mumbai. My worry is post the withdrawal of this lockdown, post 3rd of May. So we need to, many of the Mumbaikars have to travel on local trains to commute to office or wherever for their daily activities. So I, being a person who travels on a daily basis on local trains, so how are we going to protect ourselves? And I have not only me, I think lakhs of people of the Mumbaikars will have the same question and the fear in mind post this withdrawal of lockdown. How are we exposed to this virus? Because there are so many asymptomatic patients, people roaming around or will roam commute in the trains, and Mumbai trains are extremely overcrowded. So this is one question for you, Dr. Chatterjee. And my second question would be, what would be your advice to the government, if I take it in that way? Would you advise the government to further, extend the lockdown for, say, another 15 more days?
I don't know if Dr. Chatterjee can actually advise the government. Yes, go ahead, doctor.
Okay, see, when the lockdown opens, that really doesn't mean that the infection is gone. This infection is going to stay with us for the next couple of months with us. So when the lockdown is being opened, the government has to obviously decide. It has to be a very staggered sort of a lockdown open when it really begins. Even traveling or going to malls and traveling by all these trains is going to be risky. Social distancing has to become a norm of life from now for the next couple of months till the time we get a vaccine or we get a treatment to it. So it is going to be risky for anybody and everybody. Obviously, even maybe whether they start with these trains for traveling straight away, there has to be concerns. The government has to really decide how to go about it. You have to wear a mask always. You have to maintain the social distancing. That cannot go for the next couple of months. So it is obviously a matter of concern. What did the lockdown do? Lockdown obviously just helped us ramp up the medical facilities, ramp up the testing, and it made the health facilities more, so that we knew that more health facilities are there. We have the beds with us. But that doesn't mean, and it also obviously helped us slightly flatten the curve. But it doesn't mean that the infection has gone, and we have to be very careful post-lockdown opening, and it has to be a staggered opening. Now, as far as the duration of lockdown goes, there are obviously quite a few authorities, including the editor-in-chief of Lancet and quite a few epidemiologists who believe that an ideal lockdown period could be 10 weeks, or maybe depending on the situation, the government has to take a call. Also, depending on if there are infections happening again and again, there might have to be opening up a bit and then again a bit of lockdown. So this all would happen as the situation opens up.
All right.
Can I say something quickly?
Yes, go ahead.
Yeah, Miss, I live in Pittsburgh, Pennsylvania, but I grew up in suburb of Bombay, so I know all about jumping on trains, without letting other people get down. But my point is, the antibody test is going to be very widely available, hopefully, and it's going to be a quick, maybe even a finger prick blood test. And if 70 to 75% cases are asymptomatic, if many people have already had COVID, so when we open it, we should open it first with people who are IgG positive. And I think there are going to be a lot of people with IgG. So we can have some safety that maybe these people are safe. But eventually life is going to return to normal. So please bear that in mind and have hope.
All right, but a different sort of normal, a new normal in terms of, everybody will be wearing masks, and we will try and avoid, large crowds, and try to maintain as much distance as we can, as can be allowed in such situations. We have another caller with us, GS Chawla, calling in from Ludhiana. Go ahead with your question.
Yes, ma'am, my question is, if an asymptomatic woman suffering from corona gives mother feed to her child, will the child be infected? And what is the general advice to breastfeeding women in today's time of physical distance?
All right, Dr. Chatterjee.
See, there is no evidence that the coronavirus infection is going from the secretions into the child. But obviously, when there is breastfeeding that goes on, you have to have the distance, because it's a droplet infection and a fomite infection. So if you're coughing or something on when the breastfeeding is happening, then obviously there is a chance that you can infect the baby. But through the breastfeed, the chance of infection is not really documented.
All right, anything you'd like to add, Dr. Godse? I can imagine this being a worry, especially when we talk about asymptomatic people. Should mothers wear face masks
Well,
when feeding their child?
the child can get it from mother, and there's a chance that the child will be asymptomatic to recover. Another important thing to remember, I don't know yet offhand, I'll have to research it. But when we tell poor people that breastfeeding is way more important than any other artificial food that mother can buy, because mother's immunity goes through the breast milk into the child. So the child is protected for first 6 months. So if mother has IgG antibodies against COVID, I don't know whether they'll go into breast milk. It stands to reason that they will. So mother will be not only feeding the child, but also protecting it. So on the whole, I would continue to recommend breastfeeding.
All right, thank you, doctors, for that. We have another caller from Delhi, Amit calling in. Go ahead with your question, Amit.
Hi, Gargi. My question is to the physicians as well as maybe NDTV can do a story on this. Why people are being put under home quarantine endlessly. I mean, today I'm on home quarantine and today is the 32nd day. This is because of that infamous pizza delivery boy. He delivered food, other food as well. So he supposedly delivered me food on 24th March as per government records. He was tested positive on 14th April. And we were put, me and 71 other families were put on under home quarantine from 15th April. So the 14 days had ended in my case on 7th April. The delivery boy tested positive on 14th April. So we were first put under home quarantine wrongly because 14 days had passed. And today, even after 32 days, we are under home quarantine and no testing has been done. So I would like to understand from the doctors what's the logic in this. Most of the people that I have spoken to are asymptomatic. So I don't understand the logic. So maybe...
All right, so I think that's something more administrative, and yes, the government needs to be questioned about this. Perhaps you could go in for testing, Dr. Chatterjee, but really, we've been seeing that the duration of the quarantine also being extended in Kerala and Telangana. We know from 14 days, they now are doing a 28-day quarantine.
See, people who have had infection can be shedding the virus till 21 to 28 days also. There are reports where people say that they can shed the virus, and that is why the quarantine period has been increased and has been variable, because every day is a new lesson for us. But as far as this gentleman goes, because he had an exposure so many days back, we need to question this as to why is he under quarantine for such a long time, and even a testing has not been done on him. So we need to really inquire about it as to what is happening to him.
Right, this is a question for authorities. This is after that case of a food delivery person testing positive, and then all the families he came into contact with in Delhi have been asked to quarantine since then. Well, we have a caller from Hyderabad, Ramana Rao, calling in. Go ahead with your question.
Good morning to all of you.
Good morning.
My question is regarding plasma therapy. Everybody is discussing for the last 2 days regarding plasma therapy. Suppose, so we have some reports from around the world. Some patients are becoming positive after a period of some time. In this case, if the donor is positive, what is the fate of the recipient?
All right, Dr. Godse, would you like to answer that?
Well, our FDA has come out with a very specific protocol. So we wait either 28 days without any symptoms, and to be abundance of caution, we also do a molecular testing. So we will be testing them completely. Because we are using them as a donor, they obviously have IgG, so they themselves are protected. And we will be doing a molecular testing to make sure that they are not giving the disease. That's very important, because in Edward Jenner, when he came out with the smallpox vaccine in 1796, people were saved from smallpox, but some syphilis spread. So now we are much smarter. So we will make sure you are okay. The plasma, I hope it works, but it's not going to make you sick. The doctors will make sure. Okay.
All right, Dr. Chatterjee, in here as well, we're practicing obviously certain protocols when it comes to taking plasma.
Absolutely, the guidelines have been coming from the government, from the ICMR, and we have to stick to the protocols. If you break the protocols, then obviously there are chances of mishappenings. So the protocols have to be followed strictly.
All right, we have another caller, Venkatesh, calling from Chennai. Go ahead with your question, Venkatesh.
Good morning, madam. So I have a question on this plasma. Say I'm 40 years old and I am diabetic patient. So will this plasma work on work for the diabetic patients also?
All right, Dr. Godse?
Yeah, I think it would. I don't think there's any indication that it won't, because the plasma is the fluid part of the blood that has the hyper antibodies that against the COVID virus. So I don't think you would. With diabetes, some people, we say that people who have diabetes have slightly higher risk of contracting the disease. Slightly higher risk means it's considered as an underlying health condition. But I don't think it would be any impediment to plasma working on you.
All right, and Dr. Chatterjee, that it is a way, because we keep emphasizing the point about diabetic patients and people with diabetes in India, and we have such a huge number of diabetic people that they have to take more care, and perhaps that's why this concern regarding the plasma therapy as well.
See, if you are a diabetic and your sugars are well controlled, and if you are controlling it, you are at slightly higher risk. And if you contact an infection, maybe it is slightly worse, but it's nothing to worry you. What you need to just do is take care that the sugars are controlled, you're exercising at home, just have the right food, and that should make you almost equally at risk with other people. But you should control your sugars well.
And one quick point, if I can make it.
Yes, of course, go ahead.
There was a cardiovascular study, and that showed that stress is 4 times as important as diabetes, 4 times worse than diabetes. So guys, relax, we are getting a handle on it, so relax. That will also help you with your diabetes.
Well, that's a very important point, because a lot of people are under stress at this time. There's a lot of anxiety, and a lot of heart patients, diabetic patients also worry about the economy, about not getting enough exercise, all sorts of things. So if you could share something with us, for people like that.
Me? Yeah.
Yes.
So of course we don't want to give false hope to people, but we have to have a very confident and positive outlook that here in United States, where I live, we are allowed to walk in the parks, which is good. We maintain the social distance, we go out, we get fresh air. It's cold, but we get fresh air, and I think people are nicer, friendlier. So we need to and we have to keep talking about, we have to take a deep breath. So when we reopen the nation, say we get 5 or 6 cases, we can't panic, because by then we would know more about the disease, we would have the test. Life is going to return to normal, so we have to know that.
All right, we have a caller, Sudarshan, calling from Salem. Go ahead with your question, Sudarshan.
Hello.
Yes, go ahead.
Sir, this is, regarding, sir, this is regarding, asymptomatic patient,
Yes.
You said, around 80% of asymptomatic, they're in India. But, I read in one article, they said, asymptomatic in other countries, they show a lot of symptoms. And very few only, they don't show any symptoms. But in India, we say, most of the people, they don't show any symptoms. Is it we are somewhat immune to the disease when compared to other country people,
right,
or Indians?
All right. Yes, this is something that is being talked about, whether why we're not seeing as much spread of coronavirus. How is it that 80% of the people, we're being told by the ICMR that 80% of the people are asymptomatic or hardly suffering any sort of symptoms of the disease, Dr. Chatterjee. So there is a lot of talk about the vaccines, that the BCG vaccine, or whether it's because we constantly suffer from coughs, colds, flus, virals every season. Do we have some sort of immunity? But of course, at this point, it's all very loose talk, nothing scientifically proven.
So it is all very wishful thinking at this moment. Obviously, we are seeing less number of cases, we are seeing less number of fatalities, but we really don't know what is doing all these things. Is it the lockdown? Is it an innate immunity? Is it the BCG vaccine? A few people are even talking about the oral polio vaccine, that it might have given us the immunity. So
that's also being talked about.
Yeah. So there are different theories that are coming through. Maybe we have the innate immunity because we suffer from so many infections and the viral infections. Maybe at this moment, at least, it is giving us some hope, and it is helping us to fight this COVID-19 disease much better than the Western or the European population.
And Dr. Godse from the US, what do you think about what we're seeing in the country?
So if it is true, I didn't hear your question, but if it is true, if 80% people are asymptomatic,
yes,
really true, then for one patient that we are testing, 4 people are there in the community. So there are 4 times as many cases that could be there. that also means our mortality, the case fatality ratio, which may be at 3%, should also be divided by 4, and it might be 0.75%. And that's great then. That's great news if it is true. But you know, over here we are saying about 25 to 50% or patients are asymptomatic. I don't know why India is showing such high numbers, you know. And literally we are ashamed to call ourselves experts because we don't know anything. It could be 25 to 50. What kind of range is that?
All right, and a common complaint both in India and the US is about the testing and how we're not doing enough. We have one last caller, Michael from Pondicherry. Go ahead with your question.
Madam, my question is that whether the immune system can be... good morning, madam.
Yes, let's go ahead.
My question is to Dr. Godse, that whether the iron supplements and vitamin C B complex tablets can improve the immune systems for anemic patients, and they can be careful about this.
All right. So Dr. Godse wants to know about using supplements, iron and vitamin, and if that'll boost the immune system.
Well, you know, if you take vitamin B12 or like not B12, any B vitamin, they are water soluble. So if you take too much, you are going to pass it in the urine. Vitamin C helps generally from viral diseases. Our President Trump talked about zinc, zinc sulfate, that can increase some levels of copper and can help you a little bit. It's still not proven, but it's a supplement. Some people take it. It's safer. Generally eat healthy, right? And I think any vitamin should immunity. But I won't go out and buy vitamin. You might contract something when you go out to buy it. So just like chill,
All right. Well, thank you so much, Dr. Godse and Dr. Chatterjee, for joining us and sparing your time and answering all those questions. Thank you all for watching at home and calling in. That's all the time we have. Time for us to slip into a short break. We'll return with more.